All right. Good afternoon, everybody. It is right at 5:30, and you know how I am about time, so I'm about to get started sharing my screen. So please let me know when you are able to see the practice and pregnancy orientation by raising your hands. All right, I see the thumbs up, and so we're going to proceed. I'm giving you just a second to grab your questions because I know some of y'all said you were going to be bringing questions, and I'm looking forward to it. So this is your practice orientation webinar, and I'm your host, Dr. Adams. Just a couple of housekeeping items first. One, this is confidential, so no one will know that you are on this call. They can't see your name when you ask questions, and I will not say your name. If you're asking a question that I think is too personal, like I think people might be able to find out who you are from that question, then I might say, let's hold that for one of your visits. So we invite you to participate. Please answer the polls because I have those sprinkled throughout here to just make sure that we are all still participating and awake. And then finally, if you have to hop off at any point, because I know this might squeeze into dinner time, just know that this presentation will be available on our YouTube channel afterward. You'll get an email later on this weekend that will say, sorry, we missed you, or please feel free to watch again. So here's an example of one of our polls. If you're able to see it, who's on the call? So I want to know how many first-time moms I have on here, how many mommy veterans. So you'll hear me kind of read the question. I'll stretch a little bit as if I'm on the news, and then I'll say the polls are closed. We will end the poll and I'll share the results. And today it looks like our mommy veterans are just barely edging out our first-time mamas. Okay, so next, we're going to go through the full circle experience, which includes where we deliver, some of the office protocols. We'll go through what to expect at your pregnancy visits. I'm going to give you lots of prenatal resources. We have a whole section on exercise and one on nutrition in pregnancy. And then finally, we will have a COVID-19 update. So first of all, just a little bit about our practice. We are a collaborative midwifery model practice, which operates under the premise that pregnancy and birth are normal life processes, not a disease of which we must cure you. To that end, we follow the traditional model in that we care for normal low risk women, and we identify anyone with that identify any abnormalities. In the traditional care, if certain abnormalities are identified, though, you have to transfer out to a different acuity of care. But in the collaborative model, you're still able to stay under the care of the midwife for the physiologic part of pregnancy with physician direction for any of the complications. To that end, most labors, as long as they are normal and physiologic, are delivered and attended by our certified nurse midwives. So I know some of you came in as my GYN patient, Dr. Merrow's GYN patient. You're like, oh, all right, yeah, I'm just going to come right in and have my baby with one of my doctors. Most likely, you will have your baby with one of the midwives if everything about your labor is normal and physiologic. If there is something that is outside of the scope of midwife care, like your labor becomes abnormal, they will call physician consults. If it is something urgent, meaning it cannot wait until morning, like your labor has stopped and your baby just needs to have a different direction to come out, then they'll call either myself, Dr. Merrill, Dr. Mooney. We're always on call backing up our own midwives. If it is something emergent, meaning we do not have the 15 minutes it takes for one of us to get from our home to the hospital has OB/GYNs who are board certified in-house 24 hours a day available for true emergencies. And to put true emergencies in perspective, we had over 500, almost 550 deliveries last year, and only 3 of those did we have the hospitalists involved. The most common scenario in which the hospitalists are involved is when someone comes to the hospital and they're 10 centimeters, and actually none of us makes it there. So if you're coming to the hospital, please let us know so we can be there to catch your baby. Where do we deliver? That's a great question. We deliver at HCA Florida Memorial Hospital. So many of you delivered with us when we were at Ascension, and we were there for 9 wonderful years. And then we realized last year that we were looking for a more boutique experience, a smaller facility. It's still really close to the office, only a 9-minute drive from our main office. And they do tours. So I would love for you to see the facility where you're going to meet your little one or little ones. They have stork tours that they host quarterly. The next one, I believe, is November 22nd. When you come in for your visits, you'll be able to see on the wall where the next one is scheduled and register for it. But if those times don't work for you, they do one-on-one tours and they are very accommodating. I mean, they will meet you in the evenings, they'll meet you on the weekends so they can walk you through the unit so you can see where you're going to meet your little one. All right, a little more about the office. So we are open Monday through Thursday from 9 a.m. to 1 p.m. We close for lunch from 1 to 2, and then we open back up on Monday through Thursday from 2 to 5. So if you are calling us between 1 and 2 on one of those days, the phone is rolled over to the after hours line. The phone is not broken. The reason why we use the after hours line is because that is a direct contact to the provider on call. So the midwife on call can still take your emergencies during lunch. She is not able to take your administrative concerns. If you're going to be late for your 2:30 appointment, please don't leave that message for the midwife on call. It will not get to the front desk. Just call the front desk after 2 p.m. and one of the front desk ladies will be able to help you. We are open on Fridays from 9 a.m. to 1 p.m. If you are calling with an administrative concern at 12:55 on a Friday afternoon, you may not get an answer to it until Monday, as we're dealing with the calls that came in earlier. But of course, we will do our best to answer your questions as soon as possible. For appointments, we do not generally do walk-in appointments. Our goal is to see you as close to your scheduled appointment time as possible. And so it's hard to do that if I promise you a 3:30 spot and someone walks in at 3:27 and says, "Oh, I really need to be seen for this." And then I bump your appointment for that person. That is rude to you. That's not respectful of the time that you scheduled with me. And so we don't do walk-in appointments. There are some limited same-day appointments. There are sometimes that people deliver or cancel or something comes up and there are spots in the schedule during the day. So if you're calling in the morning with a concern and we see that there's an opening on the schedule, we're more than happy to put you into that already open spot so as not to disrupt anyone else's scheduled day. Now, if you're calling early in the morning and you're saying, I have this urgent concern, and the first scheduled appointment that's available isn't until 2 or 3 in the afternoon, we don't want you to wait 6 hours for something that we are also deeming it is urgent too. So if one of our nurses or providers suggests, hey, I think you need to go to the ER with that because we don't have an appointment until later, then that's not us saying that we don't want to see you in the office. It's us agreeing with you that this is an urgent matter and it may require an urgent care setting. When you call, the providers are not able to leave appointments to take phone calls. Again, our goal is to see the person with whom we made the appointment. So it's kind of rude for me to say to you, you have the 2:20 appointment, and then someone calls at 2:25 and I get up and leave your appointment to go talk to someone else. We have a nurse here who is able to take triage phone calls. So Tony can talk you through some of the most common concerns, feeling a little crampy, wondering about baby's movements, that sort of thing. If there's something outside of her scope, though, she knows how to get in touch with the on-call provider or one of us in the office between visits to get an answer for you, and she will call you back with that. She may not be able to answer it right at that moment, but she can catch us between patients and try to get an answer for you. If you're calling with a concern, you have to leave a message in order for us to call you back. Sometimes people will call and hang up and call and hang up and call and hang up. And if we're not calling you back, it's because we think you're pocket dialing us, because you'd be surprised how many people actually pocket dial their gynecologists. So whom to contact for what? So I mentioned Tony, who's our nurse. She will take those triage calls, but she's also the person who connects you with letters and forms for disability or FMLA. And many of you have already received some correspondence from Naisha, our OB coordinator, and she's the one who, when I order labs at your history visit, or if you need a referral to the high-risk doctor, cardiologist, hematologist, whatever, or if at the end of pregnancy you need something scheduled, like your delivery, if you're having a belly birth or an induction or a version or even a circumcision for your little one. And then if there's something administrative, I believe everyone on here who had a prepayment plan or had insurance concerns has spoken with Renee Hall. So all of you will be pregnant, I believe, on here through the end of the year. So if anything changes with your insurance and you're wondering, will Full Circle still be in network? Will HCA Florida still be in network? Please don't hesitate to reach out to Renee if there's something about your insurance that is changing or that you don't understand. After hours, there is always someone from our practice on call for our practice. In order to reach that person, you just call the main number that you would normally call to make an appointment or to reach us. You'll hear it roll to the after hours line and you'll get the prompts to leave a message for the on-call provider. Now, this is for emergencies. So this is if you think you need to go to the hospital. It's not prescription refills. It's not, can you go over my ultrasound one more time? This is the person who is in the hospital, attending deliveries, taking care of sick mamas and healthy mamas. And so she really needs to be able to focus on that and not looking up things that are in the computer. You must leave a voicemail in order for her to even know that the call came through. It's not readily visible that calls come through unless a message is left, because again, people accidentally call us all the time. Other ways to reach us include the patient portal, but please remember that the portal has a response time of up to 2 business days. So during the week, that is 48 hours. But on the weekend, if you send a message on Thursday, it may not get a response until Monday. I know personally, Friday is my OR day. So if someone sends a late message on a Thursday, they probably will not hear from me until Monday. There are times some of us will check, earlier than that, but this is for things that really can wait for 2 business days. If it's a non-action item, like just something you wanted us to know, then that may be passed to the person who's going to be seeing you at your next visit, and you may not get a response to it, not a, hey, thanks for letting me know. And that'll be something that you guys can discuss when you see it. So a good use of the portal is things like, I lost my lab slip. I know you told me to get these labs done before I come back, but I can't find it. Don't want to go to the lab without it because they might not have my order. Can you just send me another one? I'm going in 2 business days or more, and we're happy to email you another one. Or if you need to cancel or change your appointment, you can, message front desk with the appointment request feature. I have COVID, so I need to cancel my appointment or convert it to a virtual visit, and then reschedule it. What we don't want to see on the portal are urgent matters. So people still do this, and my blood just runs cold when you do it, sending me messages that say, I haven't felt my baby move all day long. That's not something that can wait 2 business days. If your blood pressure is really high, if you're having heavy bleeding, those are not things that we should be waiting or putting on the patient portal. That is a phone call. We ask that you not send blitz messages because sending the same message to multiple people does not get it answered any faster. We all have the same 2 business days. So blitz messaging is when you copy paste the same thing to like all the midwives and all the doctors and just hope that somebody is going to cast a bunch of stones and hope that someone's going to hit one. We have people very upset that, on Monday morning they have 5 prescriptions for different, whatever kind of medication waiting at the pharmacy. Well, which one do I take? I don't know. You reached out to 5 different people. So multiple messages to one provider and or different messages to the same provider. Just give that one person their 2 business days. And if you don't hear back from them, then definitely it's reasonable to reach out to someone else because people do take vacations sometimes. And there's no out of office response on our portal, unfortunately. We also ask that you do not attempt to have an appointment via the portal. So asking questions like, hey, can you review this study for me and let me know what the recommendations are? That is an appointment. And we're happy to do appointments in the office. The portal is really, we've seen patients all day. We've done all our charting. We reviewed our ultrasounds and our labs and sent them out. Now we want to spend time with our family. We don't want to do 25 little mini visits on the portal at the end of the day. So if it's something that can wait until your appointment, please text yourself, start a phone thread with yourself about your questions for your prenatal visits, or schedule an appointment because we have lots of appointments. All right. The other things that we communicate on the ultrasound our ultrasounds. This is communicated via the patient portal unless there is something urgently abnormal about your ultrasound. We are not going to let you walk out of the door knowing that there is something urgently abnormal that requires a plan, like a referral to high risk or something along those lines. That is the one instance in which we will interrupt our schedule. Someone will come and talk to you and make a plan for what needs to happen that day. So no matter what update you're waiting for on the ultrasound, if we let you walk out the door, just know that your baby is still okay. Otherwise, we download the reports from the ultrasound machine, upload them into our medical record system, distribute them among the midwives and physicians, and then we release them to you. So again, the same 2 business days in order to review. In the future, we are hoping to have ultrasound appointments on the same day as your return OB visits so that the providers can have a preliminary view and kind of go over it with you on that same day. That is our goal. Those appointment times may not always work for you. So if you know that you have to leave and you can't wait to get your ultrasound, have an appointment that same day, then please give us a chance to receive the reports, review them, and release them to the portal. The question that I have here now is that the same for anatomy scans when we're waiting for the baby's sex? So typically, the sonographer will tell you right then, or they're actually pretty good about even putting it in an envelope or something for you if that's what you'd like to do. You don't have to wait 2 business days to find out the baby's sex. Normally, they'll say, "Do you want to know?" And they'll tell you like right then, unless you're planning a party or something like that. It's good. That's a good question. You know who else has a portal? Quest. Except they send the results to you before they send them to us. And you guys get the results and you see red all over the paper and it freaks you out. Just remember I said this, red does not necessarily mean abnormal. The reference ranges that they use for normal for Quest are for people who are not pregnant. Pregnancy has a lot of physiologic changes that do change what is considered normal. So even if you see red, it might not be abnormal for pregnancy. So please, if you get your MyQuest results, please don't start sending messages saying, "I got my results. I've already Googled it. This is a treatment I need." Just take a deep breath. And just give us a chance to receive them, review them, and release them with our commentary, because the answer might be, "You're fine." All right. And we also ask that when you go to these other facilities, so if you go to the lab and you get blood drawn, please use the same name at the lab. It sounds like a really silly thing, but I know some of you are in the process of changing your name due to marriage and you haven't changed it with insurance yet. But maybe you're just feeling really romantic that day and you want to use his name there, but you're using your name at the office. But that is the quickest way for us to not get your lab results. Everything is electronic with us, and so it looks for certain data points to match it into your chart. And there are sometimes labs that are sitting out there not assigned to a patient at all because you all are like CIA agents with multiple identities, and we just can't figure out who you are by this lab. So name consistency also helps when we're filing claims. So let us know if you do change your name during pregnancy too, so that we can update our records as well. Alternate name usage guarantees delays. Any questions on any of that stuff before we move to the next thing? All right, cool. Now, there's a question. What do you think about sneak peek blood testing or boutique ultrasounds for gender prior to 20 weeks? Is that unsafe? It is not unsafe. And if you hang on for just a moment, I'm actually going to give you a list of places that you can go. It's like you're reading my mind. All right, let's talk about what to expect at your prenatal visits. So, as I mentioned, please expect that you are going to forget all of your questions as soon as your prenatal visit starts. So, that text thread is going to come in super handy. And as soon as you hear the baby's heartbeat, I don't know why, just everything else you were thinking about, you completely forget. We want you to wear loose, comfortable clothing so that we can access your belly. We will be listening to baby's heartbeat at every visit. That is not an ultrasound at every visit. It is a listen to baby's heartbeat at every visit. We'd like you to arrive about 5 minutes before your scheduled appointment time so you'll have time to check in with the front desk, handle any business there, and leave a urine sample if you need to. It is no longer required for you to leave a urine sample every single time. Those who need to leave one will know it's if we're following your blood pressures for protein, or if we're following your blood sugars and looking for that, or if you had a recent urinary tract infection and we need to test and make sure that the cure worked. If you're 10 minutes late for your appointment, then we'll still have time to check on you and your baby, but it leaves less time for all the questions that you have. If you're 20 minutes late, that is the entire appointment slot. And we may be able to work you in on some of those if there are openings later in the day. If that works with your schedule, we're happy to slide you into one of those spots. But if those don't work, then we're happy to get you rescheduled on a day that works better for both of us. Now, there are things like car accidents on the road that slow everybody down. We understand if the flow of the entire office is running behind. We try to use our discretion with this. But if it's just one person who's 25 minutes late and the next person is already here, again, we want to be respectful of every scheduled patient's time. All right, so the questions we get about ultrasounds. When am I going to have more ultrasounds? That was so much fun. Yes, they are. So diagnostic ultrasounds are separate from prenatal visits. So when you're booking your prenatal appointments, those are not ultrasounds. The way to know if you have an ultrasound booked is to see whether you have more than one appointment time scheduled, and is there a provider's name associated with your visit. So Tina Test, my imaginary patient, logs onto her portal and she clicks on the appointment tab. From there, Tina sees that she has two appointments. One is at 9:20 with ultrasound, which is not a provider's name. The other is at 10 a.m. with Dr. Yeckel, which is a provider's name. So Tina knows, let me bring my family in at 9:20 so everyone can see the baby. And then we're going to talk about the preliminary results with Dr. Yeckel at 10 a.m. Or my family can take off and head to work or what have you, and I can wrap it up by myself. And remember that those results are sent to the portal within 2 business days, whether or not you have your appointment on the same day. If there's something urgently abnormal, we will not let you leave the building without discussing those results and making a plan for that. So when you're checking out from a regular OB visit and your midwife says, hey, it is time for you to schedule an ultrasound, when you go up to the front desk, be sure you are getting 2 appointment times, 2 appointment slots, even if they are on the same day. And so we are typically sending a message to the front desk telling them that the appointments need to be scheduled, but sometimes you guys get up there before we can finish typing. So just let them know that you need more than one appointment scheduled when that is due. To answer the question that was just out there, yes, boutique ultrasounds are amazing. So if we do not have a medical reason to look at your baby, then you can just have a fun reason. Just go look at your baby whenever you want to. They are absolutely safe. There's no radiation in ultrasounds whatsoever. It's just sound waves. These are a couple of places around the city. There's no particular one we endorse over any, but I just tried to get one in different areas of the city. So remember that this will be out there on our YouTube channel if you need to look at this, or take your phone and just take a picture of it because it's 2024 and that's what everybody does. All right. Next, I believe we have a poll question. So hold on, I'm going to bring it up. Oh, maybe I'm not going to bring it up. Polls. Oh, okay, here we go. Ultrasounds. When should you expect routine ultrasounds? And the key word here is routine. When should you expect to have ultrasounds done? Will you expect them at every visit? Will we only give you ultrasounds if there's a problem? All right, you guys are on it, man. So yes, your routine ultrasound is done at 20 weeks. And if we see everything that we need to see at that appointment and nothing else of any suspicion happens throughout the pregnancy, we do not need to look again unless you go past your due date. And then we do post-dates testing to make sure you still have enough fluid, baby still has enough movement, and it is still safe to stay pregnant. And so that is that's the ultrasound schedule. I see that there is another question out here. Give me just a second and I will answer that one for you. Screen one. Okay. Question: what does boutique ultrasound? Oh, so boutique ultrasound is it's not a medical ultrasound. It's a fun ultrasound, so to speak. Those are just, oh, they have the really cute things where you can get the baby's heartbeat and a stuffed animal. They have 3D ultrasounds. It's really cute, really, really cute. Okay, so you'll have to give me just a second because I'm trying to figure out how to share my other screen. Hold on. All right, I'm going to stop sharing for a second. And I'm going to end the poll. Oh, I think I didn't share the results of the poll. I have 2 more questions, which I'll go ahead and ask. What if you have an IVF baby? Do you get more ultrasounds? So yes, for IVF, and we will typically talk about this when you have your history visit with me. I go through what the ultrasound schedule is that's different for you. But the short answer is it's more ultrasounds in the beginning, but toward the end you kind of catch up with everybody else. The next question I have is, when's the earliest we can get the boutique ultrasound done to find out the gender? Most of these places have sneak peek packages that start around 14 weeks or so. All right, so that gave me just enough time to figure out how to share my website. So this is Full Circle Jackson. Hopefully you're all able to see this. And lots of good information here. We'll start with the providers. So the providers, one of us will be lucky enough to help you welcome your little one into the world. There is me, there's my partner, Dr. Marrow, my partner, Dr. Yeckel, and my partner, Dr. Mooney. And then we have the midwives. There's midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. Sometimes those of you who know you're going to have a belly birth, and then sometimes when midwives are on vacation, you may see Vanessa, who is our PA, and her picture is coming soon. She is much lovelier than that stethoscope, I promise. All right, over here under patient information, you will see the obstetrics tab, and we're going to go through lots of good information with this. So first, you'll see our delivery stats. And so our information is out here back to 2018. We're very transparent with our C-section numbers, our VBAC numbers, and we know these are some of the reasons that some of you have joined us, is to help our stats, to improve our stats. Please help and improve our stats. Next is the prenatal care timeline, and we'll click on here really quickly. So this is what to expect at each visit. So everyone on this call has already had their initial prenatal visit between 8 and 10 weeks, sometimes a little bit later. Maybe you didn't find out until later. And then you come in and you have your confirmation visit with Taylor. You see one of the midwives afterward, and they will kind of just show you where all of these resources are. So then after that, you have a virtual visit with me. And at the virtual visit with me, I go through your medical history, and then I order these standard prenatal labs. So we have lab transparency here. I have seen people from other places and they say, well, I don't really know if I was ever tested for that before. You will know what is standard here because it is all listed right here and exactly when we're supposed to be doing that test for you. So you had your dating ultrasound, you have your virtual visit with me. I order the blood work, and your homework is to try to get it done as soon as you can. Some of you opted in to do genetic testing. So the genetic testing typically tells you about whether baby's at risk for Down syndrome, or if you're a carrier for certain genetic syndromes. And those can be done anytime after 10 weeks. And so at this point in pregnancy, we're seeing you every 4 weeks. So approximately 4 weeks after you had your initial confirmation, you will have your OB physical exam. And the physical exam is just like it sounds. We listen to your heart, listen to your lungs. We do need to complete the culture panel that is part of the standard prenatal labs. The PAP is not part of the standard prenatal labs. Some of you are due for a PAP and you say, if I'm getting a pelvic anyway, go ahead and do my PAP because I'm due for it, but it is not required that you have a PAP with your prenatal labs. Those of you who need to see the high-risk doctor for whatever reason, we probably discussed it at our history visit already, and this is right around the time when they start seeing you. Usually they see you around 12 or 13 weeks. Then we move into second trimester, continue with the every 4-week visits. And you have a belly check in the second trimester. We start talking about the fun stuff like when you start feeling baby move and all that good stuff. And then around 20 weeks, as we discussed, is when you have your anatomy ultrasound. And you'll see here in the middle the mental health screen. So the mental health screen is not just for people with history of depression or anxiety. So if that's something that we identified during our history visit, don't worry, we're not singling you out. This is for everybody because pregnancy comes with a lot of emotions, and we want to make sure that we identify those who are at risk for postpartum anxiety, rage, depression, all of those things. With your anatomy ultrasound, if you see a midwife on that day, we'll start talking about childbirth education and or breastfeeding classes. About 4 weeks later is when we do the glucose test, and I know we will have some questions about that, so we're going to put a pin in it, and I promise I will come back to glucose testing. My moms who know that their blood type is Rh negative, we want to make sure that your RhoGAM, if needed, is available to give you between 28 and 30 weeks. This is a good time to tour the hospital, kind of do your dry run so you know where you're going, and you're going to select a doula if you plan to work with one then, and do your hospital pre-registration. This is when it ramps up and we start seeing you every 2 weeks. So here you'll see in the middle, there is an option to repeat or decline your standard prenatal labs. So ACOG recommends doing them at least once. The Duval County Health Department recommends in certain higher risk populations doing them twice. If you feel you are low risk for contracting an STD during pregnancy, you have the option to opt out of them. These vaccines that are listed over here, we do not give in the office, but we will start to discuss in early third trimester because those who intend to get them, this is the best time to do it because you have time to build antibodies to pass to your baby during breastfeeding. First-time mamas, you want to start looking to select your pediatrician. Veteran moms, decide if you're staying with your current pediatrician. And then we start seeing you every 2 weeks. It gets more intense. My moms who know they are having a belly birth, we start to make plans to get your delivery date, which is different than your due date. So the due date is when you're 40 weeks. Your delivery date will likely be somewhere between 37 and 39 based on your individual circumstances. My moms who have pregnancy complications like high blood pressures or high blood sugars will have more frequent testing during this time and more frequent ultrasounds. And then we continue with the every 2 week visits until about 36 weeks when we do one more pelvic exam to screen for group beta strep, which is not an infection, but an important bacteria to identify in pregnancy. If you've already opted out of third trimester STD screening, then you've opted out of repeat cultures unless you tell us differently. Then we start seeing you weekly. It gets even more intense. So this is when you're going to start working on your birth plan and bring it in so we can talk about it, start your natural cervical ripening methods, and then by all 39 weeks, all our belly births scheduled will typically be done. For those who are waiting for labor to start, this is the hardest part. You have to be patient. And we would like everyone to deliver by 42 weeks. So at the 42-week mark, everyone should be evicted. For first-time moms, 41 weeks and 5 days is when we like to schedule labor induction. For our veteran moms, 41 weeks and 6 days, just because your labors tend to be shorter. First-time moms, your labor is usually about 24 hours, just to set that expectation, because I don't think that we do a really good job setting that for you. But 24 hours is about the average for a first-time mom. So questions that I have here, what are natural cervical ripening methods? How can I get info? You can stay tuned because I'm going to talk about them in just a moment. Great question. All right, so next thing here is pregnancy safe medications. And I believe I have a poll. Y'all hang with me. All right, if you have a headache, are you more likely to meditate? Are you more likely to take Tylenol? Are you more likely to go to the emergency room? The polls will be closing in 5, 4, 3, 2, 1, done. All right, sharing the results. It looks like today we have more medicators than meditators. And I wonder if that's because we have more veteran mommies than first-time moms. A little less patience. Great. Pregnancy safe medications. I know you all, some of you I've already expressed to me, oh, I've got this nausea, I've got this constipation, all these really, sexy things no one told me came with pregnancy. But I can't take anything because I'm pregnant. Well, that's not true. There are some relief measures that you can do. So here we have a list of common discomforts of pregnancy in alphabetical order. And in the middle, you'll see the things that we would recommend that you try first. So if you send a portal message, the first thing I'm going to say is, have you tried everything on the website? And some of y'all are getting slick. You send me messages and say, Dr. A, I've already tried everything on the website. What else can I do about this? But at least I know that you've tried all of my first suggestions. So as you take a look at those, I'm going to answer all these questions that I have here. For VBAC, what is labor duration? As long as your baby takes, as long as you both look safe. We do not have a time limit on how long it takes for you to VBAC. Next question, for second-time moms, how much quicker is labor? Second labor is usually half the length of first labor. And next question is, what about veteran moms that had a C-section and want a VBAC? Your body may treat this as a first labor depending on how far you got with your first labor. If you made it to 10 centimeters, you'll get to 10 pretty quickly. But if you didn't, then your body will kind of slow down after whatever point you reached last time. Next question. It's an extension of that question. Is it also a 24-hour labor or is it shorter? And that, as we said, depends on what your last circumstance was. And the next question is, what about common aid for dandruff in pregnancy? Heard you can't use dandruff shampoo. You can definitely use dandruff shampoo. And we're going to talk about some cosmetic stuff toward the end of the webinar as well. I love this crowd. You guys are talking to me. All right, next. So just scrolling down here to the next page, you'll see on our list of pregnancy things, there are some caveats. Nausea, vomiting, please don't keep trying all these things on here if you can't keep down fluids for 24 hours. Call us. You need IV fluids. Nothing else is going to work. Heartburn and indigestion, just stay away from Pepto-Bismol for your alfalfa, not for anyone who has an autoimmune disorder. So just remember that this is out here. When you usually need it, it's like, 1 o'clock in the morning. So definitely try these relief measures first before you call the on-call provider, because that's the first thing that she's going to tell you. And you're going to say, I could have done that. I saw it online. The next box is our gestational diabetes screening test. So I'm not going to talk about it right now, but I am going to come back and talk about it, I promise. The next box we'll open up is weight gain and pregnancy. And while it opens, I am opening this. Is mushroom coffee safe to drink? So I'm assuming you mean the ones that like everything is cooked. So like just like mushrooms are safe to eat during pregnancy. Yes, just not raw shrooms that you're making out of your own garden. And the next question is, I have no appetite. What do I need to do to make sure I'm getting what I need for baby? That is an excellent question that I'm actually about to answer with the screen that is up right now. So many of you are very concerned that you have no appetite right now in the first trimester. So what you'll see on here for our recommended pregnancy weight gain is that here in this column, you'll see the rates of weight gain are in your second and third trimester per week. So it doesn't matter very much what happens in your first trimester. Nobody feels like eating anything. Everybody's sick. You might lose some weight. Don't worry, your appetite will come back and you will gain that weight back. So there is a link here that you can click on that will give you your, you can put in your height and weight and find out your pre-pregnancy body mass index. And according to that, it tells you how much weight you should be gaining in pregnancy and all of this and when you should be gaining it and how much per week in second and third trimester. In the first trimester, your baby is taking everything he, she, or they, I wasn't moving enough, need from you. And so you are the one who's suffering in first trimester. Your baby is growing perfectly. In second and third trimester is when we want to make sure that you're able to keep more things down, and which is fortunately when your nausea gets a lot better. Next question is Wonder Belly safe to take for upset stomach? That one I'm not familiar with, so you may have to ask that one at your individual appointment. And the next question is the scale the same for twin pregnancies? And it is not. And so my next statement was going to be, if you're having twins, you can add 10 pounds onto the upper limit for each of these. And the next question is it normal not to feel very sick in your first trimester? Baby is healthy and moving, but everything is relatively okay for me. Take the win. It's okay. You do not have to suffer. Just be happy that you're not suffering. Every pregnancy is different. I wasn't sick a single day in my first one, and then I was sick every single day in my second one. They were both boys and both amazing, but one has a lot more hair than the other one. So I don't know. Maybe you'll have one of those sweet little cue ball bald babies. Next is our birth preference tab here. So birth preferences, birth plan. Preferences, we use that word because it's, like babies have plans that you don't know about. You have preferences. So we'll see what your baby has to say about how you'd like for your labor to go. We want what you want though. So your induction scenario, especially for first time moms, you have a lot of anxiety because you've never done this before. You're like, I don't even know what to expect. So this goes through a bunch of different things that you may not even have thought about. What do you want to wear when you're in labor? Do hospital gowns freak you out? Like some people have, a bad association with hospital gowns. They've had a loved one in the hospital before and they just don't want to wear that when they're laboring. That's fine. Go on Etsy, get a gown with your baby's name on it. It'll be fine. Like you don't have to dress like you're a hospital patient. That's okay. That's not unsafe. So everything on here is a matter of preference and opinion. There's nothing like there will be people out there who have really strong opinions about what you choose off of this list, but this is your birth, so you make your own decisions about it. The things I wanted to highlight is that we do not starve you. We do not strap you to the bed. We encourage you to move around because we want your baby to be an active participant in labor. So you can push in any position, you can deliver in any position. Our usual standards are delayed cord clamping and immediate skin to skin and early breastfeeding, early latch. There are some options on here about what you want to do with your placenta. The routine medications that are offered to baby are on here as well, and you always have the opportunity to bring this in and talk to the midwives. What is this? What is it for? Does this apply to me? Do I need this? What are the dangers of not doing this? That's why we are here. Information about circumcisions here, breastfeeding. There's some twin stuff on here too. And then for my belly birth moms, which is our term for a cesarean delivery. Belly birth, even if you know that for whatever whatever prior circumstances you're not going to have a vaginal delivery, that doesn't mean all your options are gone. And we can have a real party welcoming your little one. So 21 boxes here, not all 21 probably apply to you. So take one box per week, chew it in small bites, and it makes it a lot easier to digest. A couple questions I have here. This is the last question, I promise. It doesn't have to be. You mentioned speaking or people speaking with you during the webinar. How are people doing that? Oh, no, they're not really talking to me. They're just sending me questions, which is good because sometimes I go through this whole thing and no one asks me anything. Next question, is it safer for me to get a C-section for my second pregnancy? So this one is a little personal. It's got some personal health information on it, and this is an individual decision. We're going to take a look at the VBAC consent form and see whether it's the right thing for you, okay? All right, awesome. Okay, the next thing I have is cervical ripening techniques, because I think someone just asked me about that before. So cervical ripening prior to birth. If you can see this here, I can make it bigger. All right, so there are things you can start as early as 20 weeks. So raspberry leaf tea tones the uterus so that when you have contractions, they are more effective. But then after that, most of them really start at the 36-week mark. So these are things like acupuncture, acupressure, evening primrose oil, using the breast pump. So if you're looking to use the breast pump as part of your induction process, these are things you can do at home. You don't have to come to the hospital for a $6,000 a night stay to use a breast pump that you have at home. And you're not $6,000 a night. I don't know how much your house costs, but I would imagine it's cheaper to use your breast pump at home. So that is one of the induction techniques that you're looking to do. That's something that we encourage you to do before you come into the hospital, where there's also, food and your own bath and bed and all that good stuff. So you guys can read every week what's recommended on here. What you will notice is not on there is castor oil, and I'm not going to tell you why. Please feel free to ask your midwife when you come in for that. And the next question I have is, does the hospital allow laboring in the shower? Yes, absolutely. And we also have hydrotherapy. There are blow-up disposable tubs that you may labor in as well. And the tub is yours to take home. Bonus. All right. Next question I have on here, and I know I have at least one. So how many how many moms who had a C-section before or belly birth before are looking to have a vaginal delivery? I am launching this poll now. So first time mamas, this isn't you, but the information that I'm going to give in just a moment is still going to be for you. So sit tight. All right, we're closing the polls in 3, 2, 1. All right, as you can see, there are only 2 options here. Either it doesn't apply to you or yes, and you're going to rock it. All right, and I see that we do have quite a few people on here who are planning to rock it. All right, let's go. All right, now first-time moms, I want you to listen to this too, because you and the moms of the previous cesarean or belly birth are attempting to do the same thing, and that is avoid another belly birth if it is not necessary. So control what you can, because again, babies have plans, you have preferences, but these are things that you can control, ways to reduce conversion to cesarean. I say this as a former belly birth mom myself, so is Dr. Marrow, so is midwife Lauren. We are all VBAC moms, so this practice is fully supportive of those trying to VBAC. But these are the things that we all did in order to improve our own chances. And after doing many, many VBACs over the years, the moms who did all the things on this list gave themselves the best chance at having a VBAC. So you guys can read all these things. Now, first-time moms, baby position is the most common reason that people have that first belly birth. So all of these things become important to you to avoid getting that belly birth in the first place. So squats, super important. I'll talk about those in a moment. Gaining the recommended amount of weight, having a good doula. Don't cheap out on the doula. Avoiding non-medical induction. First-time moms, do not get tired and say, just get the baby out, because non-medical inductions can increase your risk for cesarean. So remember, all these things are out there. And then finally, if you have a little guy and you like to have him circumcised, we do those in the office up to 10 days of life. And these are the instructions on how to care for it afterward, including all of the materials that you will need to care for him. So all of this stuff is out there on fullcirclejacks.com. And so I'm going to pause sharing just a moment and answer a couple of questions while I go back to the presentation. And the next question I have is I've heard that if we labor in the tub, we have to give birth on the bed, meaning you cannot give birth in the tub. Our preference is that when your baby's head comes out, it is not underwater because we do not know whether or not the shoulders are going to come straight out after that. And so, yes, the policy is that the hydrotherapy is for labor comfort, not for delivery. The next question is, does Memorial have the cubs for laboring as well? Yes, there are cubs, there are squat bars, they have peanuts for positioning as well, and you can bring your own birth ball as well. And unmedicated birthing preference, but what other things other than epidurals? All of those things are on that list that we have. So you can take a look. Everything that is available is listed on that. Next question, do we need authorization to receive prenatal massages? That depends on the place that's doing the massage. If they ask for a letter, we have a pre-printed letter stating that it's okay. And you can just send one of us a message and we're happy to do that. And then next question, do they allow laboring on the toilet? It's been my experience that is just not a great idea because it's never poop. It's never poop. It's always the baby. I would prefer you to not have your baby plunge head first into the toilet. And so we have cubs though that you can position in, or you can sit in a thrown position on the bed. Because if your baby does unexpectedly come shooting out onto the bed, is a much better welcome to the world than head first into the toilet. Can they do circumcision in the hospital? We don't do circumcision in the hospital. If you live far away and need to arrange to have it done, like as you're going home, like you check out of the hospital and come to the office, we can usually accommodate something along those lines. All right, sharing my screen again. Okay, all right, so that says it's time for a poll question, but it's not. All right. I only had a coffee this morning, Dr. Adams. Why am I gaining all this weight in pregnancy? Oh my, who feels attacked? Okay. So when you say you drank coffee, did you or did you have one of these mocha monstrosities here? Did you know that pregnancy only requires an additional 300 calories per day, which is not a lot on this American diet? It takes 10 kilocalories to maintain 1 pound of body weight, and your pregnancy goal, as we saw on the website, is based on your starting body mass index. So if you're starting the pregnancy at 170 pounds, it takes 1,700 calories to maintain that. If your goal weight gain is 25 pounds, that's 250 additional calories, or a total daily caloric intake of 1950. Let's split that between breakfast, lunch, and dinner, and you get 650 calories per meal. But all I'm doing is eating my 650 per meal. But are you washing it down with that 570 drink thing? Because babies don't know the difference. A calorie is a calorie. And there are simple choices that we can make that can improve our outcomes. So looking back at this slide, you'll have time to digest, no pun intended, this slide later on. But you can see just over here on the sodium side, just making a change from traditional spaghetti sauce to herb infused marinara can cut 500 milligrams of sodium out of your diet for that day. So just kind of like we're going to really start turning food over and seeing how much protein, how much fat, how much carbohydrates is in there, and go over these things with your midwife if you have any questions about what are appropriate ratios for during pregnancy. So things we want you to eat your fruits, your veggies, your whole grain, your cereal, nuts, dairy. For my coffee drinkers, yes, you can still have caffeinated beverages, but we want you to keep it under 200 milligrams daily with the caveat that caffeine is still a diuretic. So if you're drinking coffee, just use the 3-to-1 rule. Try to take in 3 times as much water as caffeinated beverage so that you're not dehydrating yourself with that. And know that in third trimester, it can cause irregular heartbeats in the baby. And so we may need you to cut down and or stop in third trimester. Herbal teas are fine. Our favorites are raspberry leaf, ginger, lemon, peppermint. For my vegetarians who are getting alternate protein sources, and for those of you who are doing like Bradley method or those things that come with like brewer's diet, 70 grams of protein. Please do not follow these pregnancy diets that are telling you to eat 120 grams of protein per day. You will grow an 11-pound baby, and that just makes life a lot more complicated for both of us. I don't want that for you, and you don't want that for me. The next question I have is if my BMI is high when I get pregnant, is it safe to limit calories to lose weight during pregnancy? We want you to get an adequate caloric intake. Now, you can calculate what your goal BMI is, but as long and remember, baby's going to take 300 calories off of that. So you can do it, and you may be eating a healthy amount. You may lose weight as baby gains weight. If we see you losing weight, we'll estimate baby's fundal height to make sure baby's still growing appropriately. But yes, I've seen people with higher BMI lose weight as their babies grow perfectly healthy and just fine. Yes, you can have deli meat. Just be sure you are microwaving it for 30 seconds before you eat it. It does not have to be piping hot. Don't burn your mouth, but 30 seconds microwave. If you're eating cheese that is soft, please be sure that it's made with pasteurized milk. Again, we're flipping food over. So if you're buying this at Whole Foods or Fresh Market or wherever, if it says pasteurized milk, you are safe. If you're at a restaurant and you just don't know whether the soft cheese is made with pasteurized milk, then maybe you skip the brief for the evening. Canned tuna, you can have 3 of the 4 ounce cans per week. If you are pescatarian and you need to eat more fish than that, the FDA has really nice guidance here on what fish you should be eating in larger quantities because it has DHA in it, which is good for baby's brain development. What things to eat in moderation, because maybe high in fat or sodium, and what things to avoid altogether, possibly because of methylmercuries. Next question is, can I have one of those herbal teas for relaxing before going to sleep? Chamomile and lavender, if those are your key ingredients, those are fine during pregnancy too. Things you want to avoid, undercooked meats and fish. So if you are a foodie like me and you like your steak medium, sorry, you are going to have to ruin your steak for the next 6 months and eat it well done. Same thing for that yummy ahi tuna. You're going to have to get that fish cooked all the way through. My kombucha drinkers, my kimchi eaters, those are fermented fruits and foods and beverage. You want to limit, if not eliminate those, because sometimes fermentation or products that are fermented, your body can treat as an alcohol. By the same token, you want to avoid actual alcohol, including beverages that say they are alcohol free, because for some reason they still have a small amount of alcohol. They can still have legally a small amount of alcohol in them. So I don't know why they can even say that they're alcohol free. Maybe they don't charge you extra, so it's free. You also want to limit your sodium to less than 1,500 milligrams per day. Again, thinking back to that spaghetti sauce with marinara, 1,500 milligrams sneaks up on you fast. The next question I have is sauerkraut, and you're not the first person to ask me that too. Sauerkraut, you also again, if you cook it, because it's already been fermented, but you're cooking, then that takes care of some of the issue with that. Any other food questions before we move to exercise? All right, cool. Exercise and pregnancy. Uh-oh, hold on. Questions are here. Is mayo safe? Yes, yes. Mayo that's been in the refrigerator is safe. And is it okay to drink electrolyte powder that has sodium in it? Just watch your overall sodium intake for the day, and you can definitely tell if you're having too much sodium because I get these phone messages, Dr. Adams, I can't put any of my rings on anymore. What'd you eat last night? Can I be dairy and gluten free? Absolutely. And you enjoy that. Cooked sushi. Yes, cooked sushi is just fine. Just be sure everything is cooked all the way through. I know sushi was my thing too during pregnancy. That was the first thing I wanted after I delivered was raw sushi. Exercise in pregnancy. So if you were doing something prior to pregnancy, it's okay to keep doing it. Your body is already conditioned to do that. We saw lots of great examples at the Olympics this year of mom athletes who were continuing to do amazing things with their bodies. You just will not feel amazing in your first trimester, and that is normal. Give yourself some grace, give yourself some time, and you will work yourself back up to being the amazing Olympian that you were before. In the second trimester, you'll have some physiologic changes that increase your aerobic activity and accommodate more of that aerobic behavior. So just listen to your body. It's okay to start a new regimen. So if your former exercise was couch surfing and chip popping, then stop that first. And then also start doing some exercise. A sedentary lifestyle leads to a malpositioned baby. And what did I say was the most common reason I'm doing C-sections these days? It is not baby in distress. It is not big baby. It is baby with a crooked head or sunny side up. Those of you with these Fitbit watches that are adding to your anxiety about what your heart rate is all day, your resting heart rate will rise 10 to 20 beats per minute physiologically. That is a normal change of pregnancy. As long as it is not getting you dizzy and you're not passing out with it, then that is a normal change of pregnancy. If you are walking for exercise, be sure that your walking has your heart rate in the aerobic zone, which is 70% of your maximum heart rate. Your max heart rate has to do with what your age is. So you start with this number of 220. If you're 30 years old, your max heart rate should be 190. So you should not be exercising for sustained periods of time with your heart rate above 190. 70% of that is going to be 133. That's where your aerobic zone starts. So your goal is to have your heart rate between 133 and 190 sustained for 30 minutes, 3 times a week. Then your walking is aerobic exercise. Otherwise, your walking is transportation, which is good, but doesn't count as exercise. A couple questions on the floor. Swimming in the pool is good and safe for 36 weeks. Absolutely. One of my faves. I'm actually going to tell you that in just a moment. Sorry, back to nutrition. Electrolyte supplements are fine too. Yes, just watch the sodium content. Can I exercise in second trimester? What I was doing pre-pregnancy, even though I completely stopped. Yes, just work your way back up slowly, slowly, slowly. And you're about to log off to teacher class. Absolutely. We talked about that earlier today. Have fun. Have a good evening. Next question I have is Pilates okay with modification? Yes, it is. Excellent question. In fact, the exercises that we love for you to do are if you like cardio, get on that treadmill, get on your elliptical, go running, do swimming. The swimming is actually one of my favorites. If you have access to a heated pool, it makes your belly weightless and your joints are able to move a lot more. If you have an indoor bike, if you happen to have a Peloton, my leaderboard name is Off My Meds 8. If you follow, I will follow back and we can keep each other honest and put some blue dots on the board. If you were lifting weights, you can lift up to whatever you were lifting at your pre-pregnancy status. No need to increase the weights because your baby and your body are going to add resistance to your workout throughout pregnancy. If you are doing squats, listen close. Squats are my favorite pregnancy exercise. So you want to build up to at least 50 squats per day. If you're an experienced squatter and you were doing more than that, please carry on. If you are just starting out squatting at 20 weeks, you start giving me 5 squats a day. 21 weeks, you give me 10. 22, you give me 15. And you build up to 50, at least 50 per day. The more you can do, the better. Those hips open up and everything becomes long and lean. Pilates and yoga, for the question that I just had on the floor, should be completed with the pregnancy modifications, and any experienced instructor will be able to tell you what those are. It's typically things like avoiding positions that have you hanging with your head down for long periods of time, or being on your back for a long time. What you want to avoid are high intensity interval workouts after your first trimester. And it's not the interval, it's the intensity. So you can still do the low impact version of these, but sudden jerking movements as you get farther along, we don't want to shear the placenta off of the side wall of the uterus. Nothing that has you lying flat on your back for long periods of time, like excessive ab work. You can do side lying abs or standing abs, but just not lying flat on your back. And then hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, regular yoga is preferred for pregnancy so you do not get dizzy and fall on your belly. Avoid scuba because of decreased oxygenation and barometric pressure. Avoid high altitude hiking also for decreased oxygen to the baby. So 8 to 10,000 feet above sea level is where we usually say that we are safe to visit. If you have family in Colorado, go ahead and visit them, but do not go hiking with them. Contact sports, please don't take up kickboxing during this time. We've also had some pickleball incidents. So anything with balls flying at your belly, like try to avoid that. Outdoor biking after 16 weeks is not a no, it's a be careful because your center of gravity changes at 16 weeks. And as you turn corners, you will start to fall over instead of round that corner very well. Couple questions here. Anything we can do to spice up water? Yes, so some of those additives that you can, the electrolyte additives you can put into your water to make it taste better, or drop a peppermint candy in it, and that helps as well. Week 36, how many squats needed? As many as you can give me. At least 50 is the best. When should you stop sleeping on your back? Actually, you do not have to, and I'm going to talk about that in just a moment as well. It's fantastic. Okay, I think this means I have another poll question coming up. Yes, it does. All right, so poll question. Now that we have talked about nutrition and we've talked about exercise, I have a question. Can you prevent gestational diabetes with diet and exercise? You get one answer and you get 5 seconds. 4, 3, 2, 1. Over. All right. Oh, this makes me so sad. That means you guys haven't been listening to my rants about GDM. No, you can't. You cannot prevent it with diet and exercise. You can manage it with diet and exercise, but you cannot prevent it. And let me tell you why. We screen everybody for gestational diabetes because your number one risk factor is your placenta. You know how we blame our hormones for literally everything else that is wrong with our life? Same thing with your placenta. Your placenta during pregnancy gives off hormones that tell your insulin it doesn't have to do its job today. And your insulin's job is to clear your blood of extra glucose. So if your insulin's not doing its job, you have extra glucose just hanging out there, which is diabetes. That's what diabetes is. But it's diabetes because your placenta is being naughty, and that is gestational diabetes. And so if you can figure out how to do this pregnancy without a placenta, I will not screen you for gestational diabetes. But if you are gestating, you may have gestational diabetes. And you with the twins, you have twice as much of a chance. I'm absolutely going to screen you. So my moms who say, but I never eat anything sugary at all. You eat good carbohydrates. So eat your fruits, eat your whole grains and things like that prior to the test so that your body is not in shock from having a carbohydrate introduced. For those who just don't like the drink, the additives that are in the drink, don't worry, I got you. Simply Pure is a drink that is soy free, it is dye free, it is gluten free, it is BVO free, it is kosher, it is vegan, it is offensive to almost no one. But if it is offensive to you, there are still some additional patient-driven options. The fresh test is available. There's a link to that. Remember that box on the website that I didn't click? You can click that box. It has fresh test on it, it has glucoorganics, and it has glucose tablets, which are all available for purchase. If you're going to be using one of the alternative methods, please tell your midwife because Quest does not take outside glucose sources. We'll need to send you to LabCorp. Also, we'll need to write on the paper that you are bringing your own glucose source so that they're not shocked when you show up with it. And there are instructions like don't drink it before you get there, all that good stuff. All right. There's another question out here. When it comes to altitude, is flying on a plane in first trimester okay? Yes, absolutely. Flying is just fine. Yes. And we're going to talk about flying in just a moment. Childbirth education classes. So there are all sorts of classes for method, like hypnobirthing, hypnobabies, Lamaze, Bradley. So these are some that are available again for informational purposes. No, like, and if you just start, this is a good place to start your search if you're looking for the method that is right for you. These all have different nuances, and one will be the right thing for you. Breastfeeding classes, they do actually have them again at HCA Florida. I did confirm this, and people say that they are amazing. We can get you that information too. Every new parent should know CPR. Just because you already know adult CPR, it is not the same. For infants, it is different, and it's good to have a refresher as well as a link to the Red Cross to sign up for a class. Chiropractic care, we do advise seeing chiropractors to help get your baby in the right position. Be sure he or she is Webster certified, which means that's a special adjustment in order to that accommodates for the changes that happen during pregnancy. All right, we have one more poll question. How many of you plan on working with a doula? And I know I've talked to some of you already, and you have said that you already have your doula lined up, and I was really impressed with that. All right, and some of you don't even know what a doula is. I'm so glad you asked. Polls are closing in 3, 2, 1. Ooh, that is like the most even poll that we have out there. All right, so what is a doula? That is a great question. Doulas provide emotional and physical support before, during, and after pregnancy. So that means they help you with your breathing. They help you with your labor techniques. If you've taken one of these method classes, like you don't have time to go consult a book or a tape in the middle of your labor between contractions. Your doula is there to help to remind you of the things that you've learned and the strategies to help you get the birth that you are looking for. They're not giving you medical advice. They're helping you process your feelings about the medical advice you've gotten from your clinician team. They're not providing medical care, so they're not prescribing your medicines, and they're not delivering your baby. They should help you get to the hospital in time for one of us to be able to attend your delivery. If you are thinking, hey, that sounds like something that I'm interested in, talk to the midwives. They have no shortage of opinions about who their favorite doulas are and who they've seen support our moms the best over the years. We do recommend acupuncture. That's also super helpful for nausea in first trimester, discomforts in second trimester, and even for induction in third trimester. Pregnancy massage is also okay. As I mentioned earlier, we do have a letter if the place that you plan to go wants to have some sort of clearance. Most of your insurances will cover breast pumps. We have a QR code located in each exam room. So right around your anatomy ultrasound is a good time to remember. Go ahead and scan that code. Please don't go looking for your own company to provide the breast pumps because it is a long, arduous, and complicated and frustrating process. We found a company that does it very simply. They will check your insurance. They will send you the list of pumps that are covered. They will write a prescription and send it to us. All we have to do is sign it and send it back, and boom, you have your breast pump long before your baby gets there. Even if you got one in your past pregnancy, you are covered for a new breast pump for a new baby. Questions I have here. If we are already head down, still need chiropractic? Yes, because head down doesn't necessarily mean face down. So let's just be sure that that baby's in the proper position. And when is acupuncture needed? Week 36 should have or not. It cannot hurt. Sometimes it helps to soften the cervix and prepare the body for labor. In terms of FMLA, Family Medical Leave, we have contracted now with a third-party vendor that helps to get those papers back to your employer, usually in less than 24 hours. Anyone who's ever had these forms filled out at any office before knows that a lot of times the turnaround is up to 2 weeks, possibly more. And this has eliminated that and made this life a lot simpler for us and for you as well. Tony, again, is your contact person. She's a liaison for Contact with Leave Guru for when you need to take family medical leave. Another question I have, what about relaxing baths at home? Yes, we want you to relax at home. Absolutely. Just be sure that your water temperature is not scalding. A comfortable bath temperature. One day you will deliver, and then you'll need some postpartum care. So blood pressure check for my moms have any issues during labor or afterward. We usually see you back in the office within about a week after delivery. If you've had a belly birth, you're back in the office at about 2 weeks. Routine mental health screens. Baby blues are common in about 80% of women. If those feelings persist after 2 weeks, we could be looking at postpartum anxiety or depression. And again, we like to get ahead of these things. Postpartum doulas can also help us with that because if doulas are there for emotional and physical support, when do you need that more than when you just had a baby? The Motherhood Space is a phenomenal resource in Jacksonville. Jacksonville received a grant and they do counseling. It's 3-hour sessions with free childcare for babies 6 weeks to 12 years of age at the Winston Y downtown. There's yoga on the river. There's outside therapy. There's all sorts of wonderful things. And it is covered by your insurance, so it's at no cost to you. So if you're identified as someone who is at risk for postpartum depression and counseling, we will set you up with a psychologist who control that amazing resource. And pelvic floor therapy. We typically will have everyone who delivers, whether it's by belly birth or vaginal delivery, at 8 weeks, you start pelvic floor therapy. This is standard of care in many other countries. America, we're not so great at postpartum stuff, but things are different after babies come through there. And we want to make sure that we're not having trouble with urinary incontinence or pain with intercourse. And so pelvic floor therapy, we have a nurse who comes in 3 times a week who is billed through our office. So if you're in network with our insurance, then so is she. And we get that pelvic floor therapy going for you as well. Random frequently asked questions. We're almost done, I promise. Yes, you can sleep on either side throughout pregnancy as long as it's comfortable for you. This was a question that came out there before. So left side, right side, or your back. Some people who sleep on their back will get dizzy sometimes. So if you wake up feeling dizzy or, get one of those wedge pillows off of Amazon and slide it under either hip. It is not dangerous. We just don't want people laboring on their back because that's different contractions versus just sleeping. You can help paint the nursery. Be sure it's well ventilated and you're wearing your mask. You can take probiotics. You can dye your hair, including your eyebrows. You can get gel nails. If you're sitting in a salon with heavy fumes, you may want to wear a mask just so you don't get dizzy. Car travel, you guys are pregnant over the holidays. So travel is fine up to 37 weeks. If you leave after 37 weeks, you might have your baby with some strangers. You don't want to do that. You want to have your baby a full circle. Just be sure you're getting out and stretching every 2 hours. For skincare, you can use your benzoyl peroxide, your salicylic acid, just nothing that has retinol in it. So the question before was about dandruff shampoo. Most topical things are going to be okay as long as they do not have retinol in them. Flight is all right up to, for my twins, 32 weeks. For my singleton mamas, 36 weeks. After that, airplanes will usually want some sort of letter from us But compression hose, please get the medium compression hose and do your calf raises, the toe raises when you're in the seat. Drink lots of water and be sure you're getting up and down so that we are preventing blood clots. Things you want to avoid, this is usually more for my summer crowd, but no roller coasters and no water slides. Next question. Forgot to ask, does Memorial have NICU services if needed? Absolutely. So this is a lateral move for us. The NICU is the same level as it was at Ascension. In fact, it's actually the same doctors. So the same pediatrics group that covered the NICU at Ascension also rotates and covers the NICU at Memorial. And is pelvic floor therapy done or recommended during pregnancy? Not our program, but there are other programs. If you need something during pregnancy, we can refer you out for those, but then we usually do our own afterward. All right, the last thing is our COVID-19 update, and this is current. Nothing has changed since the date that's listed here. It's 2 years, man, time flies. So for vaccinations, ACOG moved from supporting either way to strongly recommending them after a study of 35,000 pregnant women in April of 21. Moderna and Pfizer are fine. Johnson & Johnson is not recommended because of its independent risk of blood clots. So all vaccines are approved for boosters. So if you are trying to bump your immunity prior to delivery, again, early third trimester gives you time to make the antibodies for your baby using Moderna and Pfizer. So if you're more than 6 months past either of those, you can have a booster. If you're more than 2 months past your Johnson & Johnson, you can boost with Moderna or Pfizer because mixing and matching is okay. Timing these against your flu vaccine, your RSV, or your Tdap is fine. You can have them at whatever interval because they do not interact with each other because they all work differently. If you do get COVID, please do not come to the office. Please do not come to the office. Please do not come to the office, please. There are also no recommendations for ivermectin, azithromycin, or Plaquenil. People used to come to the office and they got everybody sick. And y'all, there were days that I was answering the phones because I was the only one who was not sick. And that's not what you want. You want your doctor doctoring you, not answering the phones. If you do get COVID, these are the things that we recommend. One, please do not come to the office. Convert to virtual appointments. We still want to check on you, make sure that you're doing okay, but we want to do it from there, from over there. Vitamin D, zinc, and vitamin C in these doses, and starting a baby aspirin unless you are 36 weeks or more. We will also then start monitoring baby's growth because we have seen some growth restriction related to COVID infections during pregnancy. Recommended to just be supportive at home unless you are having trouble breathing or you have a fever that you cannot get down with the normal amount of Tylenol. For those of you who had your babies during the whole COVID thing where everybody was isolated and wearing masks and everything, take a nice deep breath. It's not like that anymore, okay? We are back to our pre-COVID visitations, which is 4 visitors in the room. The visitors do not include your certified doula. We're not having you wear masks routinely in the room unless you are actually COVID positive at the time that you are delivering. We don't separate you from your baby, even if you are COVID positive. We just give you N95 masks and an isolette so that baby's protected from your respiratory droplets while in the room. The question that I have here is, where should I find a pediatrician? If you don't have one by the time you deliver, there is a list of pediatricians that they have at the hospital, and they will make sure that you not only have one, but have an appointment with one before you leave the hospital. So our last question here is, what information can you find on the website? Can you find the birth plan, safe medications, what to expect at each visit? Or are you the stellar test taker who knows you have to read all the way to the bottom and know that it's all of the above? All right, polls are closed. Fantastic. Please remember that we are social, so follow us on all the things. Sometimes we say stuff. We haven't said stuff in a little while, but we will say more things coming up soon. So we have accounts on all of these, and we are looking forward to hearing your rockstar birth story soon. And the next question is, if we're delivering in the OR, how many people are allowed in the room? This is for twins. We actually have not necessarily been delivering twins in the OR recently. So that's an interesting twist that we can discuss at your visit. And the next question is, do you labor and postpartum in the same room? No, there are labor and delivery rooms, and then there are recovery postpartum rooms at HCA. All right, and let's see. I think those are all the questions out there. All right, thank you guys so much for rocking with me. I appreciate you. I appreciate all the questions. If there's anything that you didn't hear very well, remember this will be on our YouTube channel later on. I appreciate you with every beat of my heart, and I'm returning all those hearts to you as well. You guys have a great evening. Bye.